No matter what, take your time. Take your time. That is the thing that makes a big difference. As long as you can do 85 questions within 5 hours, which typically most people can get, go through. And I'm slow. I'm a slow reader, so it might take me 5 hours to do 85 questions. But as long as I can get to that 85, or anybody can get to that 85 and do well and take your time to answer correctly, you will pass. People have not just with me, but there have been people with other tutors that I've followed who ran out of time. And even though they ran out of time, the computer had to shut off because that was it. It may have been giving more questions, but they made at least 85 questions. They ran out of time, but they still passed. Because if you did very well on those 85 questions, or however many questions you did, but as long as you got 85 questions minimal, as long as you did that, and if you ran out of time, it's going to test you, it's going to score you based upon what you did complete. So you can still pass. So don't worry about time. Take your time. You just got to get to 85. If you get under 85, anybody who does not complete at least the minimal, they will fail you no matter what. You have to do at least 85 questions. But if it's been, that you've been repetitive trying to take it, I always say slow down. Just take your time, get through those questions, work on it every day. Do 5 to 10. Do if you have to do 5 to 25 really. And I recommend 30 to 50 every day. But if you have a day you can't do that many, do something, do 5. But every day you want to make sure you're doing something related to NCLEX, whether it's studying content, doing questions, listening to audio. You can break it up. Do that 5 to 6 days a week, at least one day to rest and relax. And it has proven, especially for this new exam, it's been very successful. So I had two, let's see, two. Both of them did not finish the program, and then one person was they were just coming out of high school, but they didn't do any questions, maybe like one set of case studies. And I'm always recommending, you got to do your questions, got to do questions, got to do it. You got to complete make your deadline, complete the program. But everyone else that has completed the program, if they went through the whole program with this NGN and all the case studies, they pretty much made it. So just take your time, go through it. You can do it, just like she said. I believe in you. You all can do this. All right, so let's see. Tonight, we are going to review the answers to our case study this week. So we'll go through that case study. We're on Prioritize Hypothesis, which is the third NGN skill. And then we'll see who, if we had any winners, or how many people. I don't think I put any names, but just how who might have gotten it correct, how many people got the answer correct. And I'm looking at seeing for prizes if anyone turned in their answers to the case study, if anyone answered correctly, and also are attending the webinar tonight, or if some people may not have been able to attend, but they did register, and maybe they also turned in their answers. All right, and then we'll see what case study we'll be doing for next week. Next week, we're going to do generate solutions. All right. All right, so we are on, let's see, prioritize hypothesis. This is basically, they're considering an analysis. This is just your AdPi. So in AdPi, this would be the D, part of the D in AdPi, because they kind of split it up. So this would be part of the D, because you would analyze your cues, which is your assessment, and then you would prioritize what you think is wrong with the patient. So all of that would be part of the D, the diagnosis. What are the concerns or client needs and problems, and what's their priority? All right, so prioritize hypothesis. That's what we did. That's what we're doing tonight. Last week we did analyze cues. All right, so when you prioritize the hypothesis, you're going to think of what can kill that patient, what can hurt the patient, which diagnosis has the highest number of complications. And then if they're wanting to know what do you need to do first, well, you need to organize and determine and prioritize the most life-threatening risks. What's the main thing that's wrong with this patient? Remember behavioral changes, ABCs, Maslow's hierarchy. Maslow's hierarchy. Patient problems are embedded in Maslow's hierarchy. So you have to know how to use that hierarchy. The base of the pyramid we know is the priority. It's your ABCs, it's your nutrition, your elimination, it's all the things that keeps the person alive. The only thing that gets a little bit different is psychosocial. In psychosocial, what will kill the patient first is them hurting themselves. Safety is the biggest issue when it comes to psychosocial disorders. Are they going to hurt themselves? Are they going to kill themselves? If they're not at risk for that, then it might be nutrition, hydration, elimination. Because if they're anorexic, bulimic, if they are bipolar and maybe they're in a manic phase and they're not taking time to eat or drink, we got to give them those finger foods. So then that would be the priority. But if suicide, if they're thinking about hurting themselves or harming themselves, forget eating, right? Because they're getting ready to eliminate themselves or harm somebody, then safety is going to be the priority. So it kind of bumps up, that safety bumps everything else if there's an issue with them trying to harm themselves. All right, so analyze cues. After you analyze the cues, you look at your assessment, you recognize the cues, you analyze what those cues meant, you identify the problem after that, and then you need to prioritize the problem from highest to lowest. So again, you will use Maslow's hierarchy of need. So that's your airway, that's your respiratory, heart rate, strength of contraction, nutrition, and elimination. The only time safety and security and protecting from injury really won't come second is if it's suicidal. So if it's suicidal, it has to go here. It's like number one, top priority. If they're at risk for suicide or harming somebody else, safety is a top priority.